research this morning suggests less may be more when it comes to treating breast cancer. The study shows less invasive treatment may increase survival rates for those in the early stages. Dr. Rache Simmons is chief of breast cancer surgery at Weill Cornell Medical College here in New York. Doctor, good to see you. So what do you think of this study that suggests maybe not surgery, but that radiation would be a better route?
Well, the study suggests is that lumpectomy plus radiation, it actually has survival advantage over mastectomy. And I have to say that I reserve skepticism on this because we've known for a long time they are equal. And it's counterintuitive to suggest that there's actually an advantage of survival unless there's a bias in the study. And we definitely saw in the study that the main advantage were in patients that actually were what we call ER positive, estrogen receptor positive, and an older age group over 50. Well, those are the best breast cancers anyway, the best prognostic indicators. So it may be there's a bias in the study to suggest a better outcome in those patients.
This was a study done at Duke University.
It was.
Your skepticism is about the methodology of the study, or?
Correct. It's a big study. That certainly is in favor of unbiased results. However, it's retrospective. And retrospective studies always have an element of bias. Was it that the physicians recommended to the patient lumpectomy over mastectomy for those that they thought were in better health or had other reasons of being a better prognostic candidate for lumpectomy? It's hard to tease that out in a retrospective study.
Who benefited the most from the lumpectomy and the radiation route? Which group?
The highest benefit were in those patients that were older, greater than 50 years old, and had estrogen receptor positive tumors, which again are our best prognostic tumors anyway.
And what if you are just been diagnosed and you hear this study, which is a lot of people, they say, oh, I'm not sure what I should do. What would you recommend?
Well, talk to your surgeon about what's appropriate for you. There certainly are some patients where mastectomy still is a better choice, and that can be patients that have more than one tumor in the breast, and really mastectomy is the only way to rid the body of cancer. The other would be patients who we know are very high risk for another breast cancer. So it may be that lumpectomy could easily treat the existing breast cancer, but we're worried about the second or the third breast cancer that will come in the years to follow.
Why is there so much more less invasive surgery today? Is it technique better?
A lot of it is technique, that we're able to use devices that allow us to make smaller incisions and be able to remove tumors that wouldn't have been possible years ago.
All right, Dr. Rache Simmons, good to see you. Thank you.
Thank you.
Appreciate it.